It looks like my vice chair is not here. We're in the last two bills. I'll turn it over to Senator Wolk.
We're going to hold the roll open till budget is out? That's the plan. Thank you. Thank you, gentlemen. Appreciate you.
All right, Senator Hernandez. Two bills.
That's how y'all treat me. I understand. You know love.
All right, this is SB 902. Senator Hernandez.
902 or 908?
908, sorry.
Thank you. Under existing law, rate increases for individual or small group health insurance must be filed with the Department of Managed Healthcare or the Department of Insurance. Department actuaries perform an in-depth reviews of all proposed rate increase to ensure that the proposed rates charges are supported by underlying medical costs and trends. In this process, the departments have been successful in negotiating down many rate increases. Consumers and small business owners have saved more than $1,400 million because of the rate review law. Since rate review began, 6 companies have moved forward with unreasonable rates at least 26 times, impacting just over 1 million individuals or consumers. Consumers and small business owners who have purchased these products only know about the unreasonable rates if they look at the website of departments or their particular companies. Departments have taken to issuing press releases in an effort to notify the public. Unfortunately, if the window to stop is closed, if a person learns they have purchased a product with an unreasonable rate, he or she is locked in for that particular calendar year. Small businesses may have some flexibility to seek other coverage depending upon their contract terms, and this bill will require a health plan or insurer whose rate has been determined unreasonable to share that information with the purchaser of that product or policy, and for 60 days allows the purchaser to shop around for more reasonable price coverages. This bill is sponsored by Health Access. I have witnesses in support, and with that, members, I respectfully ask for an aye vote.
All right, witnesses in support. Please begin.
Yeah, Emily Rush, the Executive Director of CalPERG, the California Public Interest Research Group. We were supporters of SB 1163 by Leno, which created the rate review process back in 2010. And over the past 5 years, CalPERG has participated in the rate review program at the Department of Insurance, contracting with our own actuary to review particularly large rate increases that affect a large number of consumers and weighing in with our own comments. We just completed an analysis California Health Insurance Rate Review the first 5 years that looked at all the filings that have on the DMHC and CDI websites, and to honestly take a wider look at what was happening. There were 565 rate filings posted, and I want to note that most of the rate filings are reviewed and move forward as suggested by the health insurance companies. 12% of the cases, filings were reduced or withdrawn after they had been posted, suggesting that the process is working to encourage insurance companies or carriers to make some changes as a result of the review process. And as the Senator noted, there have been 26 cases where a filing has been declared unreasonable by the regulator and has still moved forward. The experience of the program to date suggests that some insurance carriers aren't receptive to the regulator's requests for rate reductions when they find that the increases aren't justified, and we believe this bill would be a good step forward to ensuring that the consumers who are affected are aware of that fact and have an opportunity to change.
All right, thank you. Further comment?
Yes.
In support.
Beth Capel on behalf of Health Access. We're pleased to be here as the sponsors of this measure, and I have done something I don't usually do, which is show and tell. You will hear from the opposition that there's a public website that's available, so what's been handed out to you by the sergeants is a copy of the Department of Managed Healthcare's website and also a copy of the federal website where California's information is posted. The reason we did that is we find it difficult to navigate these websites, and we're people who help to craft the law and also help to care very much about knowing what rates there are. But I ask you to think about a small business owner having an unreasonable rate increase. How would they ever know that from these websites? This is, or an individual consumer. So the point of this bill is simple. It's simply to tell the purchaser and give them 60 days to shop. So it's correct that the information is public. We just don't think it's very consumer friendly. So that, as Senator Hernandez has described, the bill is simply gives the purchasers notice if there's an unreasonable rate increase and gives them 60 days to shop. If the notice of the rate increase occurs before the open enrollment period, they're directed to the amendments to the bill, direct them to the open enrollment period. If the open enrollment period, for whatever reason, is closed or there's less than 60 days left, they get 60 days to shop. And while they're shopping, their old rate remains in effect, so they don't have their rate jacked up while they're looking for a new product. So it's just notice and a chance to shop. Thank you very much.
All right, thank you. In support, name and ID only, please.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Tiffany Whitenwood, SEIU California in support.
Michael Young, California Labor Federation in support.
Betsy Imholtz, Consumers Union in strong support.
Elizabeth Landsberg, Western Center on Law and Poverty in support.
Further support?
John Joseph, AARP, California, on behalf of 3 million members in California in strong support.
Further support? All right, seeing none, opposition. Please come forward. Welcome.
Thank you, Madam Chair, Mr. Chair, and members. Nick Luizos on behalf of the California Association of Health Plans in opposition to SB 908 because it enacts new disclosure requirements on health plans that we believe are unnecessary and potentially misleading. It creates new special enrollment options that we feel will cause disruption in the market, and it also results in punitive rate freezes that we believe are unfair. SB 908 specifically requires plans to send individual enrollees or small employers a new and distinct notice separate from the notices that they already receive when a state regulator has deemed a rate increase as unreasonable under the existing rate review system. We believe this is problematic for a number of reasons. Number one, the new notice under SB 908 fails to include a critical feature of federal regulations, which allows a health plan to explain its rationale for moving forward with the rate. And secondly, the proposed notice may imply to the consumer that they must switch to a new product, which is not the case under existing law. If individuals and employers misinterpret this notice, we believe it'll cause needless churn in the market. We just have to note that consumers already receive a rate renewal notice at the annual open enrollment period. At that time, they can evaluate a rate increase if there is one, and can make a decision accordingly, either to stay with their current product or to make a switch. We also oppose SB 908 because it gives affected consumers new enrollment options even after the annual open enrollment period has closed. We believe that's highly problematic. We do acknowledge that special enrollment periods are sometimes necessary, but regulators at the state and federal level are actually reevaluating some of these enrollment options and refining their current list of options in order to ensure a more stable insurance market. In some cases, special enrollment periods are being eliminated by the federal government. So we think that creating more enrollment options, some of under this bill actually overlap with the existing open enrollment process, can create uncertainty and lead to unforeseen costs for all consumers. A particularly objectionable component to the bill is that it freezes rates and in some cases would require the health plan to go back in time and change rates after a new rate has gone into effect. We're not sure how our members are going to comply with that, and again, creates more uncertainty in the market, particularly as it pertains to rate development. So there are many components to the rate development process. I'm not going to pretend to be an actuary. And health plans always must be adequate enough to meet the demands and the experience of the covered lives, as well as the reality of rising healthcare costs, particularly skyrocketing prescription drug prices and hospital costs. Predictability always helps in developing adequate and accurate rates, but freezing rates and allowing people to come into the market outside of an open enrollment period or the existing special enrollment periods makes it harder to price products and thus creates uncertainty and unforeseen costs for the healthcare market. So for those reasons, we are opposed to SB 908. Thank you.
Okay, thank you. In opposition?
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. I know it's late, so I'll be brief. Besides the comments of my colleague, I think we're also would like to point out that under a bill that was passed last year, CDI now has 120 days. We submit our rates along with our new policy forms 120 days prior to open enrollment. That would be one of our concerns is that we think if we could, we have an opposed unless amended position, if we could narrow this down to simply a notice that happens upon renewal at that 60-day mark, and it would run conjunction with the open enrollment period, and also sort of look at a requirement on the regulator to review and approve those policies as well as the rates within that first 60 days. That's something that we would be open to having a discussion, but unfortunately, as the bill's written today, we're opposed unless amended.
All right, thank you. Further opposition, ID only, please.
John Winger on behalf of America's Health Insurance Plans, also opposed.
Luis Sanchez, Blue Shield of California, opposed unless amended. We look forward to continued dialogue with the author. Thank you.
Teresa Stark with Kaiser Permanente, also in opposition. Thanks.
All right, are there questions from the committee? All right, hearing none, would you like to close?
Yes, I'm always open to a stakeholder process and to obviously address, if at all possible, the concerns of the opposition and look forward to working with them and respectfully ask for an aye vote.
All right, is there a motion? All right, it's been moved to pass to appropriations. Please call the roll.
Hernandez. Hernandez, aye. Nguyen. Hall. Hall, aye. Mitchell. Mitchell, aye. Monning. Nielsen. Pan. Roth. Wolk.
Aye.
Wolk, aye.
And what is that? 4-0, that will stay open for the absent members. Item number 6, SB 1159, California Healthcare Cost and Quality Database.
Thank you, Madam Chair and members. This bill requires reporting of cost and quality information so that when fully implemented, this information will be put into the hands of consumers so that they understand their financial liability and can make informed decisions about health care coverage and care. We have more work to do, and I'm sure such a huge endeavor will take time, but I'm confident we'll work this together. And with that, members, I respectfully ask for an aye vote.
All right, in support?
Beth Capel on behalf of Health Access California, pleased to be here in support of this measure that would create a database on cost, quality, and health disparities that would include health information and health care costs and allow us to meet the quadruple aim of improving health care, improving the health system, reducing costs, and reducing health disparities. So with that, and we would note that the bill, after it left this committee last year, was substantially amended to include privacy protections. And indeed, an important thing is that the information be available to researchers so that we can have the most robust possible conversation about reinventing healthcare delivery in this state. Thank you.
Okay, thank you. In support?
Betsy Emholtz for Consumers Union in support, and we want to really thank Senator Hernandez for his continuing attention to this difficult, sometimes, issue about how to gather together all the diverse pieces of health quality and cost data that are out there in the healthcare system, but not consolidated in one place where we can really get a handle on the overall health system costs. We value your recognition of that and are in strong support. Thank you.
In support?
Elizabeth Landsberg with the Western Center on Law and Poverty, also here in support. Thank you.
All right, thank you. In support, ID only.
Tiffany Whiten, SEIU California, in support.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Michael Young, California Labor Federation, also here in support.
John Joseph, AARP, California, in strong support.
Further support? All right, opposition? Please come forward. Welcome.
Thank you. Becca Kramer on behalf of ACLU of California. We continue to be opposed unless amended, and I'll keep it brief because you all have our recommended amendments and it's late. The first thing that we would like to see is to have the protections in the California Medical Information Act, CMIA, apply to this bill. As currently drafted, the language in the bill is insufficient because the agency and the database are not covered entities, and therefore none of the protections in CMIA apply to them. Adding a simple subclause that would extend those protections by making these covered entities for this purpose would address our concern on that and add really significant privacy protections to this data. Second, the bill as currently drafted limits public disclosure of data, but not private disclosure, and we need to see that loophole closed to protect people's private, confidential medical information from being disseminated further than what is necessary to achieve the purpose of this bill. Third, we would like to see that the data as collected is encrypted. As we all know, data breaches are very common in this day and age. A treasure trove of personal medical information would be very appealing to hackers, and encrypting this data would add protections to ensure that if a data breach were to occur, the data would be further protected. And fourth, we would like to see data breach notification schemes as currently in California statute extended to this data. Thank you.
Thank you. In opposition?
Good afternoon, Aaron Lewis with the Consumer Federation of California, and we have an opposed unless amended position. We strongly support the object of this bill, very laudable and commendable. We do still have privacy concerns similar to ACLU, and I won't go through them in detail here, but we look forward to working with the Senator's office and the committee as we did last year on SB 26. So thank you.
Thank you. In opposition, ID?
This is Jennifer Alley with the California Association of Health Plans. We actually have a concerns position on the bill, and we look forward to working with the author and his staff in addressing our concerns as it moves forward. Thank you.
Okay, thank you. Next.
Nikki Moore with the California Newspaper Publishers Association. We are not opposed, but we're concerned about some language that would make about contract confidentiality, and we hope to work with the author's office.
All right, further opposition? All right, seeing none, are there any questions? Is there a motion? All right, it's been moved by Senator Hall. Would you like to close?
Yeah, thank you, Madam Chair. I mean, this is an issue that I've been working on probably close to 4 years. We've had a lot of hearings on transparency, and the absolute most important thing to me is controlling costs, and I believe by having this, that's a way we can do it. The problem we've run into is we've either been held in appropriations or finding an entity where we're going to house it. But by looking at the cost trends, the outcomes, we can look at how we're going to reduce healthcare costs by having this. And I'm always looking forward to working as with any opposition, see if we can address, especially the privacy protections. And I respectfully ask for an aye vote.
All right. The motion is due pass to the Rules Committee. Please call the roll.
Hernandez. Hernandez, aye. Nguyen. Hall. Hall, aye. Mitchell. Monning. Nielsen. Pan. Roth. Wolk. Wolk, aye.
It's 3-0. We'll hold that open for the absent members, and that concludes the agenda, but for the votes.
Okay, what I'll do now, what I'll do is I'll lift the call for all the bills so that members that are here can vote on them. We still have members in other committees, and then this way we can wait for them, and we'll lift the call again at that point.
Start with the consent.
So we're going to start with the consent calendar. That's item number 3 and 8, SB 1067 and SB 1258. Call the absent members.
Hall. Nielsen. Nielsen, aye. Roth.
That's 6.
That's 6-0. That's enough to get out, but we're going to place it on call. Item number 1, SB 908, Hernandez, healthcare coverage premium rate change. Call the absent members.
Nguyen. Nguyen, no. Monning. Nielsen. Nielsen, no. Pan. Roth.
4-2.
4-2. We're going to place. You were here. You were here. We're lifting the call so that the ones that you missed, You can leave early. We can leave. I'm doing it.
Thank you for me. I appreciate you.
Okay, let's reopen item number 1. We're going to lift the call, SB 908. Call the absent members.
Monning,
Did the chair support that one?
Yeah.
Aye.
Monning, aye. Pan,
Aye.
Pan, aye. Roth,
Current 6-2, we'll place that bill on call. Item number 2, SB 969, call the absent members.
Hall,
Aye.
Hall, aye. Monning,
Did the author accept the amendment to 24 hours? Thank you. Aye.
Monning, aye. Nielsen, Nielsen, aye. Roth,
Currently 8-0, we'll place that bill on call. Item number 4, SB 1090, Mitchell, call the absent members.
Monning,
Aye.
Monning, aye. Nielsen, Nielsen, aye. Pan,
Aye.
Pan, aye. Roth,
Current vote count is 8-0. We'll place that bill on call. Item number 5, SB 1135, Monning, call the absent members.
Hall,
Aye.
Hall, aye. Mitchell, Mitchell, aye. Roth, 7-1.
Current vote count is 7-1. We'll place that bill on call. Item number 6, SB 1159, Hernandez, call the absent members.
Wynn, Wynn, aye. Mitchell, Mitchell, aye. Monning, Monning, aye. Nielsen, Pan, Pan, aye. Roth, 7-0.
Current vote count is 7-0, and let's relift that one. Call the absent members. Item number 6, I'm sorry. We're going to call the absent members. Item number 6.
Nielsen, Roth, Roth, aye.
Okay, 8-0, that bill is out. Item number 7, SB 1238, Pan, call the absent members.
Hall,
Aye.
Hall, aye.
9-0, that bill is out. Item number 9, SB 1291, Bell, call the absent members.
Hall, Hall, aye. Mitchell, Mitchell, aye. Nielsen, Nielsen, aye. Roth, Roth, aye.
9-0, that bill is out. Item number 11, SB 1316, Woke, call the absent members.
Nielsen, Nielsen, no.
7-2, that bill is out. Item number 12, SB 1377, Nguyen, call the absent members.
Hall, Hall, aye. Monning, Monning, aye. Nielsen, Nielsen, aye. Pan, Pan, aye. Roth, Roth, aye.
Current vote count is 9-0. That bill is out. Item number 13, SB 1404, Leno, call the absent members.
Hall, Hall, aye.
Current vote count is 9-0. That bill is out. Item number 14, SB 1419, Galgiani, call the absent members.
Hall, Hall, aye. Monning,
How did the chair vote on this?
Aye.
Is there any discussion about? I'm staying on.
Nielsen, Nielsen, aye. Pan, Roth, Roth, aye.
Current vote count is 7-0. That bill is out. Item number 15, SB 1466, Mitchell, call the absent members.
Wynn, Wynn, aye. Monning,
Number 15.
Monning, aye. Nielsen, Nielsen, aye. Pan, Pan, aye. Roth, Roth, aye.
We're going to start from the beginning. Again, we have 9-0, that bill is out. Item number 1, SB 908, call the absent members.
Roth, Roth, aye. 7-2, it's out.
7-2, that bill is out. Item number 2, SB 969, Nguyen. Call the absent members.
Roth, aye. 9-0.
9-0, that bill is out. Item number 4, SB 1090, Mitchell. Call the absent members.
Roth, aye.
9-0, that bill is out. Item number 5, SB 1135, Monning. Call the absent members.
Roth, aye. 8-1.
8-1, that bill is out. Consent calendar, item number 3 and number 8. Call the absent members.
Hull. Roth, aye.
Current vote count is
Mitchell.
Mitchell for consent calendar.
Mitchell, aye. 8.
Current vote count is 8-0. Those bills are out. And that concludes the business of the Senate Health Committee, and we are adjourned.